Welcome to Evidence in Action, a series that highlights how you can incorporate scientific evidence into your practice. Evidence in Action is a partnership between the ACA and the Palmer Center for Chiropractic Research. To see the whole series, visit acatoday.org/research.
Hello, I'm Dr. Zach Shannon, postdoctoral research scholar at the Palmer Center for Chiropractic Research. Our topic today is the Evidence in Action article entitled Collaboration for Low Back Pain Treatment in Older Adults. I am joined today by Dr. Stacy Salisbury. She is an assistant professor at the Palmer Center for Chiropractic Research and has authored multiple papers on older adults. So, Dr. Salisbury, why were older adults chosen for this study?
Thanks, Zach, for having me today. First, older adults experience back pain at rates similar to younger and middle-aged adults, but they're not usually enrolled in clinical trials. So we don't know if the treatments used for younger people are safe and effective for older adults. Second, older adults with back pain report more problems with activities of daily living. They get out less, they have more risk of falls, sleep problems, and use more medication. And all of these things together put older adults at risk for not being able to live in their own home. And finally, older people are less likely to seek out healthcare solutions for their back pain, in part because of ageist attitudes that both healthcare providers and older adults might hold about pain. I'm old, so I should hurt. This just simply isn't true. And so these are three reasons that we decided to test an intervention with older people.
What is the significance of studying collaborative healthcare models?
Well, we know from research that when people of any age experience back pain, they go see two different types of providers first. They see primary care providers like their medical doctor, and they see doctors of chiropractic. But the research also tells us that MDs and DCs don't really collaborate when they're taking care of patients. They don't share records, and they don't let each other know what type of treatments they're providing. And so that's what Collaborative Care for Older Adults, or COCO, attempted to solve.
Can you tell us more about these healthcare models?
Yep, our model had kind of three parts. One was interprofessional education. We got the medical doctors and the chiropractors to have lunch together, to get to know each other, to talk about taking care of older people, and to learn about the different types of treatments that they use. Second off, we developed a secure website where they could share records from the research study. So each knew what was going on. We had shared background history, physical, and x-rays. And thirdly, we had a team-based case management approach where the medical doctor and the chiropractor worked with the patient to develop goals, treatments that would be of interest to the older adult, and then they supported one another's recommendation so that the older adult was getting the same type of message.
So if you could condense this down into a take-home message, what would that be?
Well, we had patients placed into three different groups. The medical doctor, and the chiropractor, who each kind of did their own thing, and the medical doctor and the chiropractor who worked together in that shared model that we discussed. The good news was that people in all groups reported modest but clinically significant improvements in their measures of pain, back pain, and disability, which we measured with the Roland-Morris. So patients in all the groups got better. We didn't find statistically significant differences between the groups, though. So what we can't say is that that increased communication made much of a difference as far as back pain goes. We can explore that part in future studies. But I think the most important message, take-home message to both healthcare providers and to older patients who have back pain, is that conservative treatments offered both by medical doctors and doctors of chiropractic have promised to improve back pain and disability. So go talk to your doctor.
Thank you, Dr. Salisbury, and thank you for joining us to see how to incorporate research evidence into practice.
Thanks for watching. If you'd like to learn more about incorporating evidence into your practice, visit acatoday.org/research or visit the Evidence-Based Clinical Practice Toolkit at palmer.edu/toolkit.